Hello, I'm Dr. Scott Trenhaile. I'd like to take a few moments to discuss with you some important aspects about your upcoming surgery. Please feel free to stop the video and take notes so that we can address your concerns prior to your procedure.
Hello, my name is Alyssa and I'm part of Dr. Trenhaile's nursing team. Prior to surgery, you may be asked to obtain lab work, a history and physical from your primary care physician, and/or clearance from other medical specialists that you are under the care of. Directions for all blood thinners should be coming from their offices. You may also be asked to obtain and use a preoperative skin prep solution prior to your procedure. If you have any questions or concerns, feel free to contact our office.
Hello, I'm Michael Gilbertson, Dr. Trenhaile's physician assistant. I'll be assisting Dr. Trenhaile the day of your surgery. On this day, please come to the procedure with a driver that can stay throughout the entirety of your care if an outpatient procedure is to be performed. Please make sure to wear loose-fitting clothing that is easy to put on after the procedure. An oversized button-down shirt seems to work best the day of the surgery, as it will be more comfortably fit and easy to take on and off, and it will fit easily over your pillow sling. Once you enter the preoperative holding area, you'll be asked to change into a gown and a nurse will place an IV. In the holding area, you'll meet with the anesthesiologist. This is your opportunity to discuss the type of anesthetic you'll be receiving for your procedure. Shoulder surgery patients typically receive general anesthesia in which you will be completely asleep. In addition, it is usually recommended that a regional nerve block also be given in combination to the general anesthetic. The block consists of an injection that is given above the collarbone on the operative shoulder after a sedative is given. During the block, you will be able to breathe on your own, but be unaware that the block procedure is taking place. Generally, I recommend this nerve block as it should provide shoulder and arm numbness that typically lasts about 12 to 24 hours in duration. It is not uncommon for you to still experiencing some numbness and tingling in the fingertips on the first postoperative day. This block will allow for you to start your oral pain medication at home as directed while the nerve block wears off. Starting the oral pain medication as the feeling in the arm begins to return allows for a smooth transition between the regional block and the oral pain medication. Side effects of the block also include not only the numbness in the shoulder and arm, but also the inability to move your elbow, hand, and fingers. The inability to move the arm typically resolves when the feeling returns or possibly sooner. It is very common for patients to experience some pain in the armpit region after surgery, as a nerve block does not provide complete relief of pain in this area. In the preoperative holding area, Dr. Trenhaile will come and meet with you and sign your surgical site. At this time, you will have the opportunity to ask any final questions before we receive any sedatives or anesthetic medications. The nerve block will be done, followed by your shoulder procedure. This surgery is an open shoulder arthroplasty procedure which requires a longitudinal incision placed over the front of your shoulder, thus enabling the implantation of the shoulder prosthesis. This incision will be closed using absorbable sutures and usually staples in the skin. A white absorbent dressing will be placed over your shoulder. The shoulder sling will then be applied while you're still in the operating room, and you will then receive an ice machine that you will take home with you. The dressing that is applied will keep the incision clean during the healing process. Occasionally, some drainage may present itself on the bandage. If this were to occur, the bandage should not be removed, but instead reinforced with more bandages. The absorbent bandage will be removed 24 hours after the surgery by your nurse, and the nursing staff will then apply a lower profile waterproof dressing that will remain in place until you are seen in the office for your first postoperative appointment. You may now take a brief shower with the bandage in place. If you have questions or concerns about the amount of drainage that is occurring, please call the number that's provided to you. It's important to note that if you're having this procedure done as an outpatient and are going home the same day of surgery, a low-profile absorbent bandage will already be applied, thus allowing you to shower at home on post-op day 1. Please leave this bandage in place until your first post-operative visit. To shower, the sling is removed and the operative arm is allowed to hang down by your side. The arm is safe as long as you do not attempt to move it in any direction. Bending at the waist to allow your arm to move away from your body using gravity will allow for safe access for the axilla during the cleaning. At this point in your recovery, I do not recommend any prolonged exposure to water, including bathtubs, swimming pools, or hot tubs. After the shower, you may towel dry the surgical site and apply Band-Aids to the surgical site. Don't try to clean the operative soap from your shoulder, as it has to exfoliate or wear off with time. The surgical portion of your procedure typically will take 1 to 2 hours to complete. After surgery, you will be placed in a pillow sling. This will need to be worn constantly until the nerve block is worn off in order to protect your shoulder, elbow, and hand. Plan on wearing the sling for approximately 6 weeks for total shoulder arthroplasties and approximately 2 to 4 weeks for reverse shoulder arthroplasties after the surgery. For inpatient procedures, you will be admitted to the orthopedic surgical unit after surgery, where you will be cared for by the amazing team of nurses. There you will resume home medications and begin a regimen of pain and anti-nausea medications that will be ordered for you. Inpatient procedures typically require an overnight stay in the hospital. Our team will come see you in the morning after surgery, and we will discharge you home on this day. You will be given written instructions before leaving the facility on the day of surgery, detailing the limitations that are specific to your procedure. After surgery, there are times when the sling can be removed. It is safe to remove the sling while seated in a chair, using a computer, feeding yourself, or using the restroom. As we mentioned earlier, you will need to remove the sling to take a shower as well. At all of those times, it is very important that you wear the sling for activities including walking and sleeping. Avoid exercise and driving until you are seen back in the office at 7 to 10 days after surgery. During this visit, x-rays of your shoulder will be taken, and our nursing staff will remove all sutures and staples from the skin. We will also discuss the next steps of your rehabilitation process, including when to initiate physical therapy. Total shoulder arthroplasties typically begin physical therapy around 4 to 6 weeks post-operatively, depending on what was found at the time of your surgery. For those undergoing a reverse shoulder arthroplasty, physical therapy is optional and oftentimes unnecessary. While each circumstance is unique, patients are typically prescribed postoperative pain medication and nonsteroidal anti-inflammatory medications. We will provide you the prescription of your pain medicine today to assure timely filling of the medication prior to surgery. We ask that you please do not take the pain medication until after the completion of your surgery. These medications are for home use only and will not need to be brought with you on the day of your surgery. The medications are chosen so that they may be taken together safely as long as you follow the directions on the pill bottles from the pharmacy. Basic risks associated with any surgery include, but are not limited to, things like blood clots, infections, failure of the procedure or implants, nerve damage, and need to repeat surgery. These risks are low, but nonetheless are known risks to the procedure. You will be given a dose of antibiotics through your IV before your surgery to reduce the risk of infections. If you are experiencing fevers, chills, night sweats, or excessive drainage from the incisions, please call the office immediately. It is important to note that future use of antibiotics prior to dental procedures will be recommended to reduce the risk of infections to the shoulder. You should contact our office for antibiotics prior to dental procedures. It is important that you inform our healthcare team of all medications that you take on a regular basis, including supplements and over-the-counter medications. You may be asked to stop some of these medications prior to surgery. Remember, nothing to eat or drink after midnight the night before your surgery. Thank you for your attention, and we will now be in to answer any further questions that you have.